we also have to learn it in a way that we should be able to teach, others how to use Healy, right? So are we ready? So Rajan, can you make the host on my other phone as well, so that I can share my screen? I'm not able to share my screen. So I'll share my mobile screen, and from my mobile screen, I'll be using those apps which we have to download, and then we'll start using it. I see a lot of new people. Most of you have bought, most of us are from different places, not just Bangalore. I can see. I'll just love to invite Mr. Karthik Kumar Mishra and just say a few words before we, because I don't know. You can introduce yourself. So what do you do? Where are you from? Who introduced you? And why did you buy Healy? You have to unmute. Yes, Rajendra, just help everybody to unmute. Yes. Yes, sir, you can unmute yourself now.
I'm Karthik Mishra.
Yeah.
I live in Bahrain, but I have my hometown in Cuttack, Odisha.
Oh, wow. Okay.
I was on a visit to India and my hometown. I met Jyoti Singh, who's my very close old friend. And she introduced me as we were talking in a conversation in a very casual, manner. And so I knew about frequency treatment, and I believed in vibrations, the effectiveness of vibration and the chakras. So I had a lot of interest in that. And when she showed me this device, I tried it on myself and for sleep, and I did the aura reading, and I found it interesting. It made sense to me after checking the background of the promoters, the team that was behind it, the science. And then I did some research online, and I found this article from National Institute of Health, which said that they had done a clinical trial of frequency treatment on cancer patients, and it was effective. And so that was, I think, a very convincing article. And I decided that, I should go for this and try this.
Absolutely. So have you used it for some time now, or you just got it?
Not really. I've ordered one, but it hasn't received. It hasn't reached me because there was intervening holidays.
Yes.
So I expect that this week I will receive the instrument, and
absolutely,
we are looking forward.
Don't worry, we will have this recorded as well. So in case you are not able to follow this, this session is getting recorded. You will get the recording as well.
And in fact, if you allow me to ask you that we should have a reference number contact with whom we could, contact and find out for if we want to use it and try it for special purpose,
Yes. We are going to learn all of that today.
Thank you very much.
Welcome, sir. Dr. Sanjeev is also there. So happy to see him, and so happy to hear his testimony last week also. So great. So I think we'll get started now. Everybody is ready, and we have 96 people. Let it be 100. Okay. So I'll share my screen. If you can see my screen, just give me a thumbs up. You should be able to see my screen now. Okay, so as soon as we get Healy, as soon as we order Healy, we need to download 3 apps. One is Healy 2, which you see at the bottommost on the right side of your screen, Healy 2, which we call pink app. Then on the same row, on the last row, that is the Healy 2 is on the last bottom corner on the left. You just go Paytm, grab, and then you will see Healy, the blue dot. It's called Heal Advisor Analysis app. And then just on the left of it is Heal Advisor app. So what Mr. Karthik just asked is that for a specific challenge, how do we use it? So that app will help you to decide or find out which are the programs you need for a specific challenge. That is Heal Advisor, Heal Advisor Analysis, and Healy 2. Now, this is an old version of the blue app, Heal Advisor Analysis. That is the blue app. You see blue dot app. There is a blue dot in it. So that's why I call it blue dot. So this blue dot app is an old version. The old app, there is a new app called Heal Advisor Analysis 2, which I'm not going to use it today because there are some upgrades still happening. So I'll continue with the old app itself, right? So as soon as we get Healy, what we have to do is we have to follow one system for everybody, irrespective of what challenge he or she has. whether he or she has cancer or is absolutely healthy, he has no challenges or he has certain challenges, does not matter. It's just that if the person has multiple challenges and he's taking a lot of allopathy medicine, then we just continue the same process for 2 weeks instead of 1 week. So for first week, the entire process for every Healy user is the same, right? Is the same process for every single human being who gets Healy in their life for the first time. So what is that one thing that we all follow for first 7 days? We'll see it on your screen. So Rajendra, can you share that screen? So meanwhile, Rajendra is sharing the screen. So you can see this. Here what you can see, it says option 1. Option 1, it says day 1 pure from the gold cycle, day 2 care, day 3 being energy, day 4, day 5 relax, day 6 release, and day 7 balance. And these programs have to be run minimum 3 times with wire if you are absolutely normal. Like if let's say you have a pacemaker or an insulin pump or something to do with your with battery, some battery equipment inside your body, then you are recommended to use the coil, not the wire. But all these programs have to be taken 3 times in a day. For children, use the coil. For pregnant women, use the coil. But for rest of us, we'll all use, even they will also do the same thing. They will also run the 7 gold cycle program for first 7 days in the same sequence. The only difference is they will use the wire, they will use the coil, we will use the wire. Okay. So option 2, parallelly at the same time, we'll use the blue dot app. So we'll see one by one. Okay, right? All your questions will be answered after the session. So keep it parked, or you can just type it on the chat box. So happy to see we are on a lucky number 111. So 111 people joining us, and I hope I'm audible, visible, clear to each one of you. Great to see all of you. Amazing. Now I will share my screen. So coming back to the screen. So what we have to do is option 1 first. Option 1 was what? Gold cycle through pink app, and option 2 was gold cycle through blue app. So first I'll open the pink app, that is Healy 2. The moment you open this app, the pink app, it's called the pink dot app. You can see the pink dot there. That's how it is called, the pink dot app. So once you open the pink dot app, it will ask you to register or something like that. So mine is already registered. So you just have to follow next, scan your device, and then it will be ready to use. So to scan the device, you need to scan the QR code at the back of the device. Just turn the camera of your phone and scan the device QR code. It will be connected. Mine is already done, so I don't have to do it again. Now, you see here, okay, upgrade available. So I'll update now. So see, since I opened, there was an update available. So I clicked on it. It's getting updated. So like this is what will happen to you also. When you log in for the first time, it will ask you for update now. You just click on update now, it will update. So update done. Once the update is completed, you go with the gold cycle. Gold cycle is the first program of Healy. Can you see that? The gold cycle, right? So we click on the gold cycle. Can everybody see it? This is my professional package. So you can see the gold cycle on the top. Click on that. Now, you see, these are the 7 programs which we have to take for next 7 days. The time we get the device, for next 7 days, we have to use only these programs in the same sequence as we displayed it on your screen just a while ago. If you don't have the sheet, the PDF or the file which we just showed on the screen, you can just contact the person who gave you the device, through whom you got the device. They will send you the file which you can follow. And if you are not able to get in touch with the person, then no problem. You can get in touch with any one of us, and we will send you the file, and you can follow the same structure and for next 7 days. So what we have to do is, first is, for the first day, we have to run pure 3 times. Okay. So remember, few things before we start using Healy is, if you are somebody whose skin is very dry or not so moist, then have enough water, apply some lotion on your body, make it little smooth or a little not so dry. It should not be very dry. If let's say somebody has cirrhosis or something like that, if they have liver problem, then the skins will be very dry. So in that case, use coconut oil on your body and then start using Healy. So what you do now is, you see this, you will get a strap. You have to use it through wire. So you see this wristband. So you just wear it on your hand like this and keep the button over the nadi, the nerves. Okay, here. You can also keep it here, but I prefer it here because it's directly on the nerve. This is where we, even the doctors, they touch here. The healers also, they sometimes they touch here, and the nadi healers, the one who senses your nadi, and they sense how to basically sense your nadi and then tell what is the disease or what is the challenge. Okay, so wear this first before you click on the pure program. The first day is pure program. So click, wear these bracelets first. How to wear these bracelets? Very simple. Now you must be thinking, why I'm showing you how to wear bracelet. It's very important. You never know. Some people have questions on that also, how to wear it. So no problem. If you have ever worn a strap kind of a watch or a friendship band, this is how it has to be worn, right? Now you will also get these electrodes along with the device, which is absolutely in the package. You don't have to pay extra for this. So these are the electrodes which you get. So you see, this is one end and this is another end. Okay. So you put this on any one of the hand, the other one on the other hand, and then take these electrodes, the other end, and insert it inside the device. Now you see, when you're inserting, there is something called plus and minus. Most of the programs are polarity neutral, means polarity does not matter. But in case some programs say put plus on right hand and polarity matters, if says that polarity matters, plus minus is relevant, then you have to put plus in right hand for male, plus is left hand for female. You might not remember, plus is right hand for male, plus is left hand for female. Mauli dhaga, after our puja, we tie Mauli dhaga. Mauli dhaga is tied up on the right hand of the male. So plus is right hand of the male, and same Mauli dhaga is tied up on the left hand for female. That's plus for her. So here the programs do not, the gold programs are not relevant. Like plus minus is not relevant. So you can wear it as you wish. So now you insert this and collar it, pin it, or hold it in your hand for some time, and then click on the pure program. When you click on the pure program, what it says, this is how you have to wear the electrodes. Maximum program duration is 52 minutes. What does maximum program duration means? It means if there is a sensor in the device which senses your frequency requirement every 10 seconds. So in case the device senses that you don't need 52 minutes, it will end before 52 minutes. Okay. So it is an individualized micro frequencies. So people ask, oh, what if it is too much or over? No, the device will decide. If it is too much, then you will not, you don't need it. It will not go inside your body. So every 10 seconds, the sensor senses your requirement. Now, before I click on start, there are few things which I have to take care. Now, let's say I am giving this gold cycle program to my mom, and she is not somebody, let's say for an example, she is not somebody who can operate this. For an example, she operates it, and I'm just giving an example. Let's say she is not somebody who can operate it. And while I click on the start now, she should hold the device, not me. Why? Because as soon as I click on start, the app will instruct the device to generate the frequencies as per my requirement, because I am holding the device. If I am wearing the bracelet and somebody else is holding the device, then the transmission of the frequencies or the instruction of those frequencies will be as per the person who's holding the device. This is in the pink app. Okay. So I am holding the device, but before I click on start, let me read the instruction. It says bracelets on both hands, application recommended daily. The polarity of electrode does not matter, is not relevant for this program. The program, and then it can be also used with Healy coil. So you can use also with the coil. How to use the coil? Just insert it at the back side, just where the wires are inserted, same place you insert the coil and use it, keep it in your pocket, in the upper pocket or in the lower pocket. Okay, am I audible to everybody? Clear. Very good. Great. So now I click on start. The moment I click on start, you see this transmission is happening. And once this transmission is happening, this device should touch my body. So I can even pin it here. The maximum distance from the device and your body is 10 centimeters. Because even the program is running, it has to sense my body requirement. If it does not sense, it will still run on the previous instruction, but it can change the instruction if it is near my body. Why? Because it has a quantum sensor, which is a patented sensor, which Healy has. So it is going to sense my frequency requirement. Okay. So now the transmission is complete. Now, the moment you come to this page, this is where people get confused. So listen to it very, very carefully. I request all of you to listen to carefully, because I know the question answer session, you might ask me the same question, even though I would have repeated it, but I know that questions will still come, but I'll still go ahead and say. The moment you get the screen, you see it says a frequency is generated, but no current is flowing. That was written on it. So first check the electrode, then increase the intensity. So if I am using Healy for the first time, I will increase the intensity. If my age is in my 20s, I will keep it at 35%. If my age is in my 40s, I'll keep it at 40%. If it is I am in age of 50, I will keep at 50%. If I am in 60s, I will still keep it at maximum 65%. So anything between 35 to 65%. So let's say I'm using it for the first time, so I prefer keeping it 50%. I can also go at 45 or 50%. So let's say when I'm running at 40%, the waves are still not moving. Example, here the waves are moving. The waves were moving even at 15%. So the wave have stopped at 20%, let's say. Now the waves have stopped at 20%. So it means the frequency is not going into my body. The current is being generated, but frequency is being generated, but it's not going in my body. Why? Because electrodes might not be proper, or the intensity of the current is low. So here the intensity is low. So I'll increase the intensity and see when the current flows. So let's say the current starts to flow at 30%. It does not mean that you will keep at 30%. Minimum 35, maximum 65, at least for your first 7 days. After 7 days, yes, if it is flowing very well at 20%, keep it at 20%. Low is good. Less is more. Lesser is good. With wire, with coil, 100%. With wire, maximum 65%. With coil, always 100%. Are we clear on that? With coil, 100%. With wire, 35 to 65%. Okay. So now it is running. Now the another challenge where people always have this question, or they get stuck, is what they think is that you have to monitor this as a share market. In share market till 3 o'clock, you keep looking at the screen. You don't have to look at the screen now. You don't have to look at these frequencies now. Just come out of the app like this. Not like pausing. No, don't pause and come out. Don't pause it. Don't pause the app. So here it is pause button. Don't pause it. Without pausing the program, come out from here in the center button. Now I can do my work. I can go ahead and disconnect my Bluetooth. I can go and disconnect my Bluetooth and I can run my programs. So you don't have to be connected on the phone. The program will get over exactly after the time is over. When the device decides that the program should be over, it will be over. How do you know? The green light you see is blinking. So means program is running. The blue light is blinking, means the Bluetooth is connected. So let me come out of the app and then disconnect my Bluetooth. I disconnected my Bluetooth. Now you see the blue light is off, but the green light is still blinking. Can you see it? The green light is still blinking, means the program is running. Now let my pure program be over. Insert these wire under your shirt. No, I generally keep it inside my shirt, and then so that nobody can even notice. Somebody sending me some money, that's great. Okay, so keep it inside your shirt and forget about it. We don't have to do anything apart from that. Just let the program run. You have seen the program duration was 52 minutes. So you can look at the watch and see, okay, 52 minutes is approximately 10:15 or 10:20. So at 10:20, your program will get over. Now, before you run the second program, that is pure 2. Pure, we have to run 3 times, right? On day 1. Am I clear to everybody? Is everybody able to follow what I'm saying? That's good. So once the program is over, you give a gap of minimum 1 hour and again run the pure program. While the program, you're running the programs or you're using the device, please drink at least 300 to 5 ml ml water during the program, right? Drink enough water. If your body is hydrated, that is where it is going to do miracles. It is going to be very, very easy for your body. Now, let's say out of curiosity, I want to know what is the status of my program, but I had already disconnected Bluetooth. So now I'll switch on my Bluetooth, again open the device, and it is again searching the device. So the device is running the program. The pink app is still on. So it's running the program. Now, once the program is already running, and when I connect, let me connect. So it is trying to locate my device. And yeah, it should be, it will get connected. Once it gets connected, yes, so it has located the device. If you move your phone near to the device, it is easier to connect. So it's getting connected. And once it gets connected, it will tell me that there is already a program which is running from XYZ minutes. So it's connected. It says it has been running from last 6 minutes already. So go to the next, don't cancel. If you cancel, it will stop. Go to next, and you see it will just show you the current one where it is right now there. So the program is still running. You don't have to be connected to the app, to your Bluetooth, to the app, to the device all the time. Only while transmission. After the transmission, set the intensity and just forget about it. Do your work. If you are in office, do your work. If you are in kitchen, do your work. If you are in washroom, don't use it in your washroom. It's not waterproof. But everywhere else, you can definitely use it. Also, don't use it while sleeping because you might entangle yourself. It's not advised to use while sleeping. Yes, if you fall asleep, it's okay. But don't wear it, run a program and go to bed, because at night you might get disturbed because your wires will disturb you at night. So don't do that. Apart from that, yes, you can go ahead and use it. So this is what we have to do for 7 days. What we have to do: first day pure, second day care, follow the same file which Rajendra just shared to all of us. Follow the same pattern for next 7 days without fail. Let's say you happen to give a gap. Somehow you had to give a gap of 1 day, you could not use it. No problem, start once again. Let's say on the 6th day you gave a break. So from 7th day, you start pure again. So 7th day become your day 1. So for 7 days, everybody does the same thing, irrespective of what challenge he or she has. If the person is under severe medication for a long time, continue the gold cycle for 2nd week as well. Okay, so 1st week only gold cycle with both the apps, with the pink app and the blue app. Let's say you are a very busy person and you don't have much time, then you can just stick with the pink app for first 7 days, and then you can learn about the blue app. But let's say you somehow are serious about your health, you can manage some 10-15 minutes extra for your health, then no problem. Go here, open the pink app. Now, I have to disconnect this pink app because now I'm going to talk about the blue app. What we have to do in the first 7 days. So we learned the gold cycle. We have to do what? We have to do gold cycle for first 7 days, pure, then care, then being, then in the same pattern, not the display pattern, the pattern which you saw in the file which was shared on your screen. In the same pattern for first 7 days, we just follow gold cycle. That's all. Okay. Now, people who are having pump or pacemaker, they use the coil. Pregnant women use the coil. Children use the coil. Rest everybody will follow the same wire one as I am doing it right now. After your after this pink cap is done for first day, what you have to do is what we have to go there and start the blue app. But before I go with the blue app, I will take on questions with the pink app. Yeah, anybody who has a question, please raise your hand and I'll be happy to help you. So good to see all of you. Huh? Very nice. When you use this device, you'll be blown away. Anybody has a question, just raise your hand. And don't raise your hand on the video because on your video, I cannot see everybody on my screen. I can only see few people on my screen as I'm using it on my laptop. Yes, ma'am, Savi ma'am, you are raising it on your screen. Okay, Ashok ji is raising the virtual hand. So let me first unmute Savi ma'am and then we will go with Mr. Ashok. Yes, Savi ji, please ask your question. Yes, ma'am, you can ask your question.
Keshav ji is asking.
Yeah, can I use it in the morning?
Come again, ma'am. Can you use it where?
Oh,
What I heard is, ma'am,
Evenings.
just ask, can you use in the morning?
I've been using it in the evening. Morning, I use the blue app. Last time you had told me about, I think Pushpji had told about those other blue app.
Yeah, blue app I'll cover right now. You can use it anytime, but use the 3 programs within those 24 hours.
Okay.
Okay, you can, there is no timing for it while eating food, while riding, while reading, while walking, while working. There is no time for it. You can use anytime you want, but give a gap of minimum 1 hour. Let's say you have 2-3 family members in your home. Just after there is a gap of 1 hour required, right? During that gap, somebody else can use it. Minimum is 1 hour. You can give also 2 hours gap, 3 hours gap, 4 hours gap, depending on how many people you are there at home.
But pure cycle I can use, or I'll have to go for a separate thing, because in blue app the pictures are there with the frequency of those people.
No, I will come to blue app, ma'am. Let us stick to the pink app questions only with the pink app now. When I say when we share about the blue app, your questions will be answered. Okay. So Anuji has said, please repeat. Repeat what? Do I have to repeat from the beginning? I don't know. So let me know what you have missed. Yes, Mr. Santaram, you can ask your question.
Yes, sir. You said if there is a break after 2 or 3 days, we should start again from pure.
Yes,
for the full week.
Yes,
Thank you.
Exactly. So we had Mr. Ashok. Yeah, thank you, sir. Ashok ji, you can unmute yourself now.
Yes, sir.
Yeah.
For the children,
Ah.
for 5 to 6 years, we can use it, this device.
Yeah, they can use, but use the coil.
Coil, how much, sir? 100%.
100%. Coil always 100%.
Okay. Okay.
Coil 100%. The percentage in the coil defines its radius.
Okay.
Right? The diameter. So in the coil, the diameter is only 50 centimeters.
Okay.
So if you decrease the intensity, the area will decrease. Okay. Only that part will get those frequencies. Okay. Yeah. So,
Okay.
We have Mamta Joshi ji. Yeah, thank you, Ashok ji. You can mute yourself now. Yes.
हेलो
Yes, Mamta ji. Please go ahead.
हाँ सर आई जस्ट वांटेड टू आस्क कि जैसे आपने बताया ना कि पिंक ऐप में इतने सारे जो प्रोग्राम हमको रन करने रहते हैं स्टार्टिंग फ्रॉम द प्योर केयर एंड एवरीथिंग तो
Yeah.
ये टोटल ड्यूरेशन ऑफ द ऑल दिस प्रोग्राम इस कितना है सारे प्रोग्रामों का टाइमिंग कितना है पूरा
हर
Each
प्रोग्राम का
program-
अलग अलग टाइम है. जैसे अभी आपने देखा प्योर में 52 मिनट था.
अच्छा
52 मिनट्स था. तो 52 मिनट्स प्योर का है, उसी तरह से गोल्ड रिलैक्स रिलीज का भी 50 मिनट्स,
अच्छा।
किसी का 50 मिनट्स ऐसे है।
ओके, मतलब अगर सपोज आपने एक बार प्योर चालू कर दिया, देन इज देयर समथिंग कि वो ऑटोमेटिकली सेकंड प्रोग्राम चालू होगा कि यू नीड टू
No, you have to again, it will stop and then you have to restart from your app.
ओके, एंड
Or
एज यू सेड एक
yeah, or
घंटे के
there is,
बाद यू हैव टू टेक ए ब्रेक।
yeah, give a break if
हाँ
the device is not in use, and
हाँ
if you're given a break of 1 hour, and if you don't have access to the app or you don't want to open the app again, just wear everything and click on this center button. It will start running the program which was the previous program it had.
अच्छा
तो प्योर प्रोग्राम अपने आप चालू हो जाएगा अगर ये प्रेस कर दिया सेंटर बटन तो।
अच्छा ओके।
When you
और this Healy instrument itself, is it chargeable? You need to charge it?
yes, you need to charge it. As soon as you receive the device, you must charge it for at least before using, no, at least for an hour as you get the device in your home. Depends on which adapter you are using. But when you put it on charge, the green light will glow. When the green light is off, that is when it is charged. So first fully charge your device and then start using the device. Without charging, if you start using the device battery life will reduce. So first charge it as soon as you receive the device, charge it for an hour, or maybe as soon as it gets completely charged, then start using Healy. Okay, there is a question in the chat box.
Thank you, sir. Thank you.
Yeah, most welcome. Usage of the device by 3 people in the family. As a gap between people using Healy. That's what I have already told Anuji. 1 hour minimum is the gap. If I am using, my program is over, I can give immediately to somebody in my family. For that, there is no gap required. I can give it to anybody else in the family. But for me, the gap should be minimum 1 hour, maximum can be anything. Okay. Yes. So I hope. So if your question is answered, you can lower your hands. If not, then you can keep you can keep your hand raised. I have a lot of other people who are raising hand. I'll go one by one based on first come first serve. So it is Mr. George. So over to you, Mr. George.
Yes, I just purchased the Healy right now. Just want to know that my child is disabled and she's bedridden. She can be able to talk and she having some medications regarding her seizures. So I just want to know it's compulsory to take the pink gap for her because I started and she having fever, some problems faced. So I already stopped the pink gap.
Okay, never stop the pink gap even though you have fever. In fact, in fever, we recommend to run pure, release and balance. So don't stop in case you get fever or because it is it's not that you are using Healy and you got fever. Fever might come anytime. So even though you have fever and you have got the device and you want to start, don't wait for your fever to get over. You can start even you have fever. It doesn't matter. You can use the pink app. What is the age of the child, sir?
She is 13 now, but she is taking medications for the seizures like that.
She has seizures?
Yeah, she having seizures. She having a health condition named as a tuberous sclerosis complex.
Okay.
So
okay.
for her, I just purchased this product. I just want to know.
So use the coil because she has scissors. In scissors, we don't use the wire. So scissors, heart pacemaker, insulin pump, scissors, child, pregnant woman. We don't use the wire. We use the coil. Use the coil. Keep running the program. It is working on her.
Okay. So it is a must for three numbers want to run per day.
Yes, absolutely.
Because she's going school in the morning and coming at evening. So and I am working and I am coming late from office. So it's difficult for her to run 3 programs per day.
No problem. Whatever is possible, run, but at least run 2 programs. If timing is the concern, if nobody else is there to take care, then we can't do anything. So, but run at least 2 programs for her.
Okay. The ping program is a must before starting any other program.
Yes, ping program is must. That will clean her information field. That will make her make her body ready to accept those frequencies.
Okay. Thank you. Thank you so much. Okay.
Yes, yes, I am reading a question in the chat. Yes, 1 hour gap minimum in the same day. Okay, so I'll request Dr. Siddharth Mishra ji to unmute yourself. Yeah, Siddharth sir, आप अपने आप को unmute कर सकते हैं. You can unmute yourself. You just have to unmute. We are not able to hear you. Okay. You can unmute if
Yeah, can you hear me now?
Yeah, now we can hear you. Yes, sir.
So good evening to you. I just wanted
Hey,
to
good
ask
evening.
you 2-3 simple things. The first thing is, how long does the device stay charged? I mean, when do you have to charge it again on the same day?
See, I've charged my device 2 days back, still running. I generally use more than 4 programs a day, 4 or 5 programs a day.
I
So
see.
I charge the 3rd day. So 2 days without charge it runs when I run 5 programs in a day.
Right. Now, the second thing is, supposing I change it to another person, I try to run the program on another person. Do I have to disconnect, close, and then open it again?
If you're using the pink app, that is not required. If you're using the blue app,
Yeah, we're talking about pink apps.
in the pink app, once the program is over, you can use it to the other person without restarting anything. Just you can simply use the program. You can run another program for that person.
Okay.
No need to restart your phone or something. Yeah.
Right. And the third thing is connection. You said that we use the Bluetooth for a short time. After that, we disconnect. We stop the Bluetooth.
Yes,
while
you can
running the
definitely
program.
stop the Bluetooth device, because during the transmission, the instruction has already been sent.
Yeah.
After that, even if your device is not connected, it will still run. So that's why some people have, by using Healy, my mobile usage will increase. It's not like that. In fact, it just takes 30 seconds to start the program. Our maximum is 1 minute. After 1 minute, you can disconnect your phone, switch off your phone, doesn't matter.
Right.
Yeah.
Thank you.
Most welcome, sir. See, if somebody else has already asked your question, then you can lower your hand, or else you can keep your hand up. Yeah. Yes, Pramod sir, you can unmute yourself and ask the question.
Yeah, Vikasji. My question is, in this order, is it sacrosanct or a pure followed by release? Would it not make a better way of doing it?
Sir, this file is sent by Academy Training, so we just follow that.
Okay, but is there any logic behind it, or?
There must be something behind it. We just follow it, right? So there must be something. So we don't go. So the goal of this training is to let everybody use the device as for the best of the result, and what the file which you are sharing, the process we are sharing gives the best result. But it's not a hard fast rule. If somebody wants to use the way he or she wants, they can definitely use, but the results might get delayed. That's all, nothing else.
Second question is, there's a low current, high current option also, no?
Yes,
So
that I will come to that as well later when I talk about the advisor app. Okay.
Fine. Thank you.
Most welcome. Yeah, Shivani ji, you can unmute yourself. Yeah, Shivani ji, you can unmute yourself and ask your question.
Yeah, actually, when I use pink app for pregnant women, what is the ideal percentage to be used?
You have to use the coil, and with coil, 100%.
Coil. Yes, 100%.
Yeah.
And suppose if I do not want to run for 55 minutes, is there any ideal time, like 20 or 15 minutes, something like that?
If 52 minutes was not ideal time, the Healy Academy would have changed it to some other time, right? So it is the ideal time which is already recommended by Healy. So 52 minutes is the ideal time. As I said, the sensor will sense if the person does not need for 52 minutes, it will end before 52 minutes.
Okay. And is there any time duration gap when we using coil? Like in using cable, we give a 1 hour gap, right? Like when we use a coil, is there any
10-15 minutes? Very good question. Yeah, while using the coil, you can give a gap of 10-15 minutes. Not more. Not much gap is not required. Drink enough water, give a gap of 10-15 minutes. You can run the second program through the coil.
Okay. And one more question, like suppose the other person, I'm healing someone, the other person has a rod in their leg, like after surgery they put that, right? So can I use that electrode for, suppose gold program, can I use the electrode for them?
Absolutely, no problem.
Okay.
If the wound is fresh, it just happened, now just transplant has happened, or just that rod has been there in his body just 1 month, 2 months back, then don't use the wire. But if it is there for 3 years, 4 years, 5 years, then you can use the wire. Yes.
Yeah.
Yes.
That's it.
Yeah,
Thank
most welcome. We have Pragya Duggarji. Pragya ji, you can unmute yourself. Yes, Pragya
Yes,
ji.
sir. Can you hear?
Yeah,
Can you hear me?
definitely. Yes. Please go ahead.
I have two questions. Just a minute. Sir. So first question is, lot of people ask me कि जब हम प्योर का मतलब जो भी detox gold cycle का program चलाते हैं in pink app, in some time it shows that Healy has been disconnected from the phone or searching for device, ऐसा कुछ दिखाता है. तो
Okay, I think she got disconnected. We'll go to Preeti ji.
Hello.
Yeah. Yes, Pragya ji, please go ahead.
Hello.
Yes, Pragya ji, we can hear you. Okay,
Hello.
so I think she lost the connection. Preeti ji.
Hello. मैं disconnect कैसे होगी?
नहीं, आपका आवाज हमें आ रहा है. You are not disconnected. You are connected. Shivani ji, if your question is answered, you can lower your hand, or shall I lower your hand? Okay. Yes, Preeti ji, you can unmute yourself. Okay. Jyoti ji, you can unmute yourself. So, जो पहले unmute कर लेगा वो बात कर सकता है. Yes, Preeti ji.
Sir, if someone is on medications like thyroid, BP, and all, for them, how you suggest, like they can start with three pure programs in a day? It is safe, or how often they have to keep checking their parameters and all?
Okay. See, I told you in the beginning, it is same for everybody.
Okay.
No differentiation whether the person is having BP, sugar, anything. Keep using the device, run the gold cycle program. You can check your parameters once in 2 or 3 days and see, monitor it. That's all. No problem.
Okay,
so pure program day 1, day 2 is not the pure. Day 2 is different program. What happened is once I gave this training and somebody was running pure program for 7 days.
Okay,
so
sir.
pure program is in day 1. Day 2 is care. Day 3 is being like that. Right?
Okay, sir.
Any other question, Preeti ji?
No, sir. Thank you, sir.
Most welcome. Yeah, Jyoti Singh ji, you can unmute yourself and ask your question, ma'am.
Good evening, Mr. Vikash.
Good evening. Good evening.
I just wanted. Good evening. I wanted to know, one of my aunt, she had a stroke and she's slightly paralyzed on her right side. So which program do I run, and can I give distant healing?
Okay. We will, the topic is today how to use Healy from the first day. So yes, you start with gold cycle. You can also give the distance healing, but start with gold cycle. Doesn't matter what challenge he has.
Okay.
Okay.
Thank you very much.
Most welcome. Most welcome. Yeah, Javin Jain sir, you can unmute yourself.
Yes, sir. Good morning.
Very good morning, sir. बोलिए sir.
विकास जी, मैं दो तीन क्वेश्चन. पर्सन किसी और कंट्री में है, बच्चा है 3 साल का, तो उसको हम पिंक कैप दे सकते हैं क्या यहाँ से?
नहीं, पिंक कैप से डिस्टेंस हीलिंग होता है, ब्लू ऐप से होता है सर डिस्टेंस.
ब्लू ऐप दूं? हाँ, ब्लू ऐप दूं. ब्लू ऐप से मैं दे सकता हूँ. ठीक है. सेकंड, ये आपके मोबाइल में बार बार ऊपर आ रहा था कि इतने आवर्स इतने वो हो चुके हैं, और वो मैसेज आ रहा था, वो कैसे आता है?
कौन सा मैसेज?
हीली प्रोग्राम इतने मिनट हुए हैं, अभी इतने मिनट हुए हैं, बार बार मैसेज.
वो मेरा मोबाइल का सेटिंग है, वो मोबाइल का सेटिंग ऑन कीजिएगा, नोटिफिकेशंस का तो आएगा.
अच्छा. अच्छा, ये नाइट में भी मतलब छोटे बच्चे को हम दे सकते हैं 4 hours और समथिंग?
Yes, you can give. You can give. The remote healing you can give.
Thank you.
Most welcome, sir.
Well,
Okay, there is a question. There is a question. If the person is taking chemotherapy and dialysis thrice a week, see, in chemotherapy there is no problem. In dialysis, what happens is we have to drink a lot of water while using the program. So start with coil and wire. When he or she, like, let's say the doctor has told to drink only half liter of water or 500 ml of water, then at the time when he is जब उसका वो पानी पीने का time होगा, when let's say the person drinks the water at 1 o'clock or some time, or when he's thirsty, so during the same time you run the program when in dialysis, because there are water restriction with dialysis patients. But let's say if the person is under chemotherapy and all, as I said, it doesn't matter, right? Use the device without discriminating whether the person is healthy or unhealthy, because this is not a device to cure any disease. It is just going to harmonize your cell. When your cell is harmonized, your tissues are harmonized. When your tissues are harmonized, your muscles are harmonized. Once your muscles are harmonized, your organs will be harmonized. And once your organs are harmonized, you are harmonized, or our body is harmonized. So please understand how Healy works. It is not for diagnosing or treating any disease. Please understand that it is not a device which cures any disease. Okay. So that's why I'm repeating it again and again. It does not matter who the person is. Just follow the same process for everybody. Okay. Yeah, Preeti ji, you can unmute yourself. I gave you the chance that time. You did not unmute.
Okay, that was another Preeti. This was another Preeti.
Oh, this is another Preeti. Okay, Preeti ji. Yeah.
Okay, so Vikas ji, usually I've heard from my team this question. So, ये distance healing जो है Blue app, can for that whatever we are running programs, can that be run back to back? Like for example, the top
Yes,
5.
it can be run back to back, but all your Blue app questions in the Blue app. Please ask only Pink app related questions.
Perfect.
Yes.
Thank you.
Yes, Kirti ma'am, you have a question. Very good. Let me listen. What is your question?
So, good evening, Vikas ji. This question is not only mine, but many people under me, they go through this situation. That when the program is running, in between, suddenly there's a very low battery. But when they're checking the battery is actually fully charged.
Okay, very good.
But,
no problem.
Yeah, so what to do about it, because the program stops in between.
Okay, nothing, no problem. Just press the center button for 10-20 seconds, restart and put it on charge. What happens is when you put your device on charge with keeping it on and then you charge it, then this problem comes. Or when you don't restart or reboot your phone after installation or something, some technical challenge while reopening or opening the app, that is when it happens. But if you face that problem, just reboot your device, it will be all right.
Okay, thank you.
Okay, welcome. Yes, we have Mr. Girish Pandey ji. Yes, sir. You can unmute yourself.
Yeah, good evening. In fact, it's a pleasure to talk to you guys after 2 to 3 months of using. Can you hear me?
Yes, sure. We pleasure. Same here, sir.
Yeah, it's been close to 3 months since I've been using the device, and it's been not a regular feature. Once in a while, I use it. There have been disruptions because of my movement and shift of job. So I just wanted to understand one thing. I have the Tridevis with me. Your top 3 players: Preeti ji, Jai Sheila, and Lena Joy, right? Yeah, Lena Joy. The 3 top contenders in your team who are there guiding me. But I have my own restrictions. I have a lot of travel work, etc. Now I have started using the device. Of late, the frequencies, the Blue app, whenever I use, it always shows that, what's that thing in the pink cap? It is self-defense, defense mechanism, whatever.
Defense program.
Yeah, that is the only thing which is highlighted every time. So every week, I go through the same cycle. Can I go through the same thing every day? After an hour's break?
Very good question, sir. Yes, see, this might happen to some of us. See, if let's say a particular program is popping up every week while doing analysis, that's what you're asking, sir. Every time you analyze,
Exactly. Not every week, maybe in 3-4 days, whenever I do it.
Yeah,
That's
yeah.
what
So
happens.
whenever you do it, one particular program pops up, it means that is highly required by you.
Okay.
So it means that your body needs that program. So when we analyze, it shows us our top 5 requirements. And if a particular program in between, I think 3 or 4 months back, defense program was showing me back to back. And that I noticed, I went to a funeral. And when I came back from that funeral, every time I used to do that analysis, it used to come on the top.
Okay.
So I was also, I also faced the same challenge. Now it doesn't come now. Now it's okay. But yes, for 2-3 months it kept coming. So maybe it was something which I grabbed it from there, or maybe it was in my mind. I don't know, but it was suggesting programs. So what in defense program it shows? Which one it shows?
It just shows. I mean, maybe I'll touch base with the Jaishila or
Yeah, because there are 3-4 things there. Maybe because of excess computer use, or since you're working, you're on laptop or mobile all the time.
Yes, I am.
Then it must be showing electrosensitivity in defense program. So it might be showing because of that.
Because what exactly to use there, I use all the things one by one. Right.
Yeah.
It doesn't make sense to me. It should be one of the things now. Whether it's muscle harmony, whether it's whatever. There are 6-7 things there, right?
Yeah.
So what to use, what not to use should also be there, no, as a feature.
No, so it is in the sequence. You will see percentage wise. So
first is weight, I think. First is weight and physically fit, weight wise. Second thing, I think, is muscle harmony and something. Okay.
Yeah.
So the whole pointed issue is what to use.
No, you run the top 3.
Top 3 only.
Top 3 minimum, or you can run all 5 if you have time, or if you don't have time, run at least top 3.
Okay.
At least top 3.
That I do, and it has to be for how many? I mean, days. 1, 2, 3, 4, 5, 6.
No, when
so
we
every time it comes to the same thing.
Yes. See, every 5 days we analyze with the Blue app. We run for 5 days. On the 6th day, if you want to take a break or you want to run the program as we desire, let's say we are feeling that I need some energy, you can next 2 days you run as per your choice. And then again on the 8th day, you again analyze, run it for 5 days as per analysis. Next 2 days, if you want to give a break or you want to run as per your choice, you can run that. So what I do generally, I run 5 days as per the analysis, and next 2 days I run as per my choice.
Fair enough. Thank you.
So since you have professional package, I have professional package. So I tell people to use nutrition, digital nutrition. Very powerful programs.
Thanks.
Most welcome, sir. Lovely seeing you here, Colonel Girish. Thank you so
Same
much.
here.
Good night.
Same here.
Sir. Right. We have Mr. Vendas. You can please unmute yourself. Yeah, Mr. I don't know. Am I pronouncing your name correct? V-E-D-A-N-S. Vedans. Okay, Vedans. Mr. Vedans, you can unmute yourself. Yeah.
Good evening.
Good evening.
This is actually I'm logged in from my son's laptop.
Okay.
So I've been using this app for about a month. So my question was, I understood what you said about gold cycle. And Jaishila had guided me correctly on that. About when you set the percentage for the first week for gold cycle, 35 to 50% depending on age. And after the first week, the percentage, the lesser the better, right?
Lesser the better. Yes, correct.
Okay. So like my son is a bipolar, so at times he is unwilling to use it. So instead of like every Monday I do the analysis for the week, and then every day I do the analysis for that particular program, and I try and run through all the 4 to 5 programs that are given displayed in the blue app. And I run it in the pink app. But on one odd day, what happens is he refuses to use the pink app. So if I just give the
blue app
through the blue app, that 37 seconds of 37 sec. No, the given
time 37 seconds.
37 seconds 7 times, and then 26 minutes.
One to 2 times.
1 to 2 times. So as a substitute, is it okay, or
it's okay. It's okay. As a substitute, it's absolutely okay. We have a very wonderful testimony from Hubli, from Mr. Onkar, and he gave only through blue app, because in hospital they did not allow to use this device through wire. So somehow some programs he was using it through coil, hiding it under the bed. His son-in-law is admitted in hospital from last 4 years. He's in ICU. He was in ICU.
Okay.
Now, and not talking, not moving, and no response, just like a vegetative state in the hospital from 4 years. And they could not use the pink app. Mostly they use the coil sometimes, 1 or 2 times, and mostly through remote healing. And we got the news that he's ready to be discharged. He started to talk. He started to move his hands and legs. So that is an unbelievable testimony. We have requested him to send some videos and photos as well. And also we'll request him and his son-in-law to come and join us in the testimony night. So yes, you can do that. But in this case, sir, you can use the coil also.
Okay.
Tuck the coil inside his pocket, stitch the pocket for some time, or do something where the device touches his body. Maybe in the pant pocket or the shirt pocket, or in the banyan, you can make a pocket and keep the device there and run the program. And that is also one way where you can use the pink app.
Okay, and like when the app is used with the coil, you said for the gold cycle it should be at 100%. So after the first week, it should be
all programs with the coil 100%.
Okay, and when you say it should touch the body, that means it should touch the skin, or if it is in the pocket,
maximum gap is 10 centimeters from the body.
Okay, so it should be on the clothing,
fabric. Yeah,
one of the
pockets can be on the fabric. Yeah, it can be on the fabric.
Okay, that was second issue that he had. He doesn't like the wristband and coils. He's finding it. So I use only coil on him. If
yes. Yeah. So what is the program for cervical spondylitis? Mr. Prakash will answer that question in a while. Just hold on. We'll finish this pink app question. Please ask only pink app questions now. Yes, Pragyaji, you can unmute yourself and ask your question. And those who have already asked the question will get the chance after the blue app training.
Hello.
Yes.
Can you hear me?
Yes.
Yeah. So, my question is often asked by my team members. कि जब हम पिंक ऐप में गोल साइकिल यूज कर रहे हैं and then there is a message popping up in the phone that your phone is searching for Healy, or maybe the program is not running. ऐसा कुछ these are the kind of questions
that is because you're not disconnected from your Bluetooth and you have moved away from the Bluetooth zone. So when you come back and you try to connect, it will show you that. So that's why I said disconnect from your Bluetooth, close the app and forget about it.
Okay.
क्या मैसेज दिख रहा है नहीं दिख रहा है कोई जरूरी नहीं, उसको जान के कोई जरूरी नहीं उसका जानने का, उसको चलने दीजिए, वो चल रहा है ना. If green light is blinking, that means it is running.
So only requirement is once the program has been transferred, you switch off Bluetooth.
Yeah, once the program is transferred and you have set the intensity.
Yeah. Then you switch off the Bluetooth.
Yeah, switch off your Bluetooth.
Switching off the Bluetooth is compulsory.
Come again.
Switching off the Bluetooth is compulsory?
No. I am just telling you to switch it off because why you want to waste your battery backup, and plus you will again that message will pop up that it is disconnected, connected. The person feels that now the program is not running. It's not like that.
All right. So let's say if I'm using my AirPods or something, I need the Bluetooth to be on. So it doesn't matter. The only thing is ignore the message. You know that the program has been transferred and it's working. That's it.
Yes, absolutely.
All right. And the second question is, I think you were answering something related to that. So one of my known person, she is, right now been diagnosed with cancer. She's been taking therapy, and she has asked me a lot of time that, can I use Healy? Can Healy work on me and all of that? So I said, see, I have really no answer for you, but I'll definitely connect with somebody and will,
See,
give you.
in today's 7:30 meeting, there was somebody who said, was it 7:30 meeting or this meeting? I forgot. I'm in meeting from morning. So yeah, he said that no, there was a research done by some medical association in India also, that whether frequencies have the ability to cure cancer, and they said yes. So we are not saying anything. It is no, other organizations say that if frequencies work, use the program and leave it to God, right?
There is any restriction when we use it for them?
No restriction, ma'am. Absolutely no restriction. Okay.
Like we use it, analyze, use all the 3 programs, start with detox, drink a lot of water, keep every same protocol, right?
Same, exactly the same. In fact, they should use 5 programs instead of 3 programs.
Okay.
Okay. So they can use 5 programs. So 3 to 5.
All right. Thank you so much, sir. And is there
age for children? 12 years. IUSG 12 years. Yeah.
And
yes.
one more last question. So, what was my question? Sorry. When you start.
Yeah, when you remember, just ping it on chat. I'll answer. Okay. Yeah, Chinmay ji, you can unmute yourself. Chinmay ji, you can unmute yourself. Rajind, can you help Chinmay ji to unmute? Okay, I can't see her. Chinmay ji, you can unmute yourself. A, B, C, D, E, F, C left, I guess. Okay, no problem. Yeah, Mr. Ranjit, please unmute yourself.
Hello.
Only
Hello.
Cap. Yes, please ask a question related to pink cap. Yes, yes, Ranjit sir, please go ahead.
सर नमस्कार, मैं कोलकाता से बोल रहा हूँ सर, और जस्ट स्टार्टे मेरे को हिली मिला है.
ओके.
सो मेरे एक कजन है, वो 13 साल का लड़का है.
हाँ.
और उसको 1.89 क्रिएटाइन है, और किडनी का माने यूरिनरी ब्लडर में कुछ डिसऑर्डर बता रहा है डॉक्टर, राइट? और वी थॉट जो हिली है, इससे हम उसको कैसे प्रोग्राम को यूज करेंगे सो दैट उसको इससे बेनिफिट मिले सर.
सेम सर, उसके लिए भी गोल्ड साइकिल ही चलाइए पहले 7 डेज, और उसके बाद मैं बताऊंगा अभी ब्लू ऐप में कि क्या करना है. आज का ट्रेनिंग सिर्फ फर्स्ट 7 डेज के लिए. 7 डेज के बाद क्या करना है ये हम 7th को एक और ट्रेनिंग होगा, उसमें हम बताएंगे. बट आप डेफिनेटली जिन्होंने आपको रेकमेंड किया उनसे आप टच में जाइए, उनको पता होगा कि क्या करना है. आपको एनालिसिस यूज करके एज पर एनालिसिस चलाना है. और मैं आपको पर्सनली रेकमेंड करता हूं कि आप विश्वरूप रॉय चौधरी जी का वीडियो देखें. BRC, डॉक्टर BRC बहुत फेमस हैं. अगर कोई भी किडनी डायलिसिस ये सब से रिलेटेड इशू है तो आप उनके हॉस्पिटल में जाइए, फ्री ऑफ कॉस्ट इलाज होता है, और जो भी इशू है वो रिजॉल्व हो जाएगा तुरंत.
ओके सर, एक चीज जो आप प्योर ये जो पिंक ऐप में जो बताया है ना, जो फर्स्ट में गोल्ड साइकिल चलाना है, तो उसमें 5-7 प्रोग्राम है टोटल. तो एक दिन में कितना प्रोग्राम उसको चलाना है सर?
एक दिन में 3 प्रोग्राम चलाना है. पहला प्रोग्राम प्योर, वो एक लिस्ट आपको मिला है, किन्होंने आपको इंट्रोड्यूस किया है?
सर उनसे मेरा बात अभी मैंने प्रोसेस में है. आई होप ही विल कम टुमारो एंड ही विल गाइड मी. उससे पहले उन्होंने हमको ये लिंक भेजे थे, सो दैट क्या आपसे एक बार.
ठीक है. वो प्योर प्रोग्राम, पहला डे में प्योर प्रोग्राम है, दूसरे डे में केयर है, रिलीज है, बैलेंस है, इस तरह से एक लिस्ट है. वो लिस्ट आपको दे देंगे. उनसे आप वो लिस्ट मांगिएगा, उनके पास होगा, वो आपको कल शायद बताने वाले हैं, तो वो बताएंगे आपको. ठीक है सर.
ठीक है सर, बहुत बहुत धन्यवाद सर. थैंक यू.
और घबराने की कोई बात नहीं है सर. आप अपने फ्रेंड को बताइए या बच्चे को भी, कोई मतलब आप BRC, डॉक्टर BRC का हॉस्पिटल है पूरे इंडिया में 4-5 जगह पे, आप उनको वहां लेके जाइए.
ओके, ठीक है सर, बहुत बहुत धन्यवाद.
फ्री ऑफ कॉस्ट इलाज होता है. आप अपने मन से जो देना चाहेंगे दे सकते हैं, नहीं तो फ्री ऑफ कॉस्ट इलाज होता है वहां पे.
BRC का डॉक्टर. ठीक है सर, मैं एक बार वो कराता हूँ. ठीक है, बहुत बहुत धन्यवाद.
मोस्ट वेलकम. यस रेणुका जी, यू कैन अनम्यूट योरसेल्फ. माय गॉड, इतने सारे क्वेश्चंस हैं इन द पिंक ऐप, आई नेवर न्यू. राइट. ओके, यस प्लीज गो अहेड रेणुका जी.
गुड इवनिंग. Good evening, Vikas ji. Am I audible?
Yes, yes, perfectly. You're audible.
विकास जी, एक्चुअली मैं अपनी मम्मी के लिए ना जॉइंट लोकल मैं उनके लिए चला रही हूँ, हीलिंग दे रही हूँ। वो एक्चुअली स्क्रीन में दिखा रहे हैं कि अ फ्रीक्वेंसी इज जनरेटेड बट नो मेजरेबल करंट इज फ्लोइंग, प्लीज इंक्रीज द इंटेंसिटी
आप
फर्स्ट।
100% पे रख रहे हैं?
हाँ जी, हाँ जी, 100% में रख रही हूँ और वो वेव्स नहीं चल रहे, मतलब जैसे हाँ जी, वो मुझे समझ नहीं आ रहा है कि उनको हीलिंग हो रही है कि नहीं, बिकॉज उनको बोलती है कि मुझे तो कुछ समझ ही नहीं आ रहा कि हीलिंग हो रहा है कि नहीं।
पहले आपने गोल्ड साइकिल चलाया?
हाँ जी, हाँ जी, गोल्ड साइकिल चलाया।
ओके, फिर से गोल्ड साइकिल रिपीट कीजिए। और पेन प्रोग्राम जो है वो फिक्स्ड फ्रीक्वेंसी है, बाकी सारे प्रोग्राम्स IMF बेस्ड हैं, इंडिविजुअलाइज्ड माइक्रो फ्रीक्वेंसी जो आपके बॉडी के रिक्वायरमेंट के हिसाब से जनरेट होती है। पेन प्रोग्राम्स आर फिक्स्ड फ्रीक्वेंसीज, तो उसमें आप 100% पे रख के चलाएंगे तो भी वो वेव मूव नहीं करेगा, तो कोई बात नहीं, उसको वेव नहीं भी मूव हो तो चलने दीजिए, वो काम कर रहा है।
अच्छा अच्छा अच्छा, ओके विकास जी, बस यही पूछना था। और एक डाउट पूछना था। अच्छा, शायद वो ब्लू ऐप के लिए होगा। ओके, थैंक यू,
ब्लू ऐप कवर करेंगे।
ब्लू ऐप।
या ब्लू ऐप विल कवर इट।
थैंक यू सर, थैंक यू सो मच, थैंक यू सो मच।
Yes, Miss Jael Sheila ji, you can unmute yourself and ask question.
Good morning, Vikas ji. Yeah, my question is from my customers basically. So this is regarding the battery. ये बैटरी क्या है? आफ्टर चार्जिंग लगाने के बाद 100%
रिपीटेड सेकंड टाइम ये क्वेश्चन
है। नो दूसरा है, नहीं कीर्ति मैम का क्वेश्चन का थोड़ा सा एक्सटेंशन है ये। आई हर्ड व्हाट कीर्ति मैम आस्क्ड। इसमें क्या है? इट विल शो 80%, 75%, 60%। 60 के बाद 50, 40, 30 पे आता ही नहीं है वो, मतलब
आंसर वही है, उसको प्रेस कीजिए, चार्ज पे डालिए, ठीक हो जाएगा।
मतलब वो लोअर बैटरी दिखाएगा ही नहीं, मतलब 10-20 जैसे मोबाइल दिखाता है 10%, 20 वो आएगा ही नहीं।
हर जैसे कोई प्रोग्राम है जो 3 घंटा का चल रहा है, कोई प्रोग्राम है 2 घंटे का, कोई प्रोग्राम है 70 मिनट्स का। सो ऑल दीज प्रोग्राम्स have different timing. So before the device starts the program, it senses that how much battery is left. If the battery is not enough for the highest program in the device, then it will show the battery is low. Okay, so put it on charge. No problem. Okay, yeah. Chinmay ji, you can unmute yourself. लगता है आज सिर्फ पिंक ऐप हो पाएगा, ब्लू ऐप मुझे कवर करना है। जिन लोगों ने क्वेश्चन पूछ लिया उनको मैं दोबारा मौका नेक्स्ट ट्रेनिंग में मिलने वाले, नहीं तो आप पर्सनली कॉल कीजिए अपने अपलाइन को। Yes, Chinmay ji, you are not unmuting yourself. I'll go to the next person. Mukund ji, you can unmute yourself.
Very good morning, associates. Vikas ji, very good morning.
Very good morning.
मेरा प्रश्न ये है कि मैंने जो ये गोल्ड गोल्ड प्रोग्राम जो है ना, जो कम से कम 15 दिन मैंने तो लिया था, लेकिन बीच में कुछ एक 2 दिन छूट गया था मेरे शेड्यूल के हिसाब से। लेकिन मैंने पूरा प्रोग्राम हर प्रोग्राम 3 बार मैंने 7 प्रोग्राम ले लिया मैंने, कम से कम मुझे 15-20 दिन लगा मुझे। तो ये मेरा पहला प्रश्न है। और दूसरा प्रश्न जो है वो सिर्फ मेरा जो करंट फ्लोइंग था वो 20 ज्यादा से ज्यादा 20 या 25% तक वो करंट चालू हो रहा था मेरा, मतलब फ्रीक्वेंसी स्टार्ट होने के बाद। तो मुझे लेकिन मेरे उम्र के हिसाब से आप ये बता रहे थे थोड़ी देर पहले, मैंने ये सुना था कि कम से कम 35 से लेके 65% तक रहना चाहिए। तो मैंने 25% के ऊपर कोई प्रोग्राम नहीं लगाता है, क्योंकि 20 या 25% के अंदर फ्रीक्वेंसी ये हुआ था।
आप जहाँ पे हैं वहां पे गर्मी ज्यादा पड़ती है?
हाँ, ये तो गर्मी तो बहुत गर्मी है यहाँ।
हाँ, तो पसीना आता होगा?
हाँ जरूर, क्यों नहीं।
हाँ, तो बस वो कंडक्शन का काम कर रहा है आपका स्वेट, नो प्रॉब्लम सर, चलने दीजिए उसको, राइट?
नहीं, क्या, हाँ लेकिन मुझे एक ही डाउट है, क्या मुझे गोल्ड प्रोग्राम दोबारा चलाना होगा, क्योंकि बीच में कुछ
इट्स ओके, नो प्रॉब्लम, आप फिर से चलाइए, कितनी बार भी चलाइए, हार्ड एंड फास्ट रूल नहीं है, बट अगर आपका करंट फ्लो कर रहा था 25% पे, परफेक्टली ओके, नो प्रॉब्लम।
ओके, ठीक है।
ओके, चिन्मय जी, यू कैन प्लीज आस्क योर क्वेश्चन।
Good evening, sir.
Hello. Yeah, good evening, Chinmay ji. You can ask your question.
So what is the difference between pink app and blue app?
Okay, pink app is basically a set of programs. If you see you bought, let's say you bought the professional, you have 229 programs. These 229 programs is in the pink app, which can be taken through the wire and with the coil. These are programs given to your cells directly. Okay. The blue app is used for analysis and also giving distance healing. And that vibrations or frequency reaches your body through your information field, not through your cell directly. Okay. So,
Yes, thank you.
Yeah, most welcome. So once we cover the blue app, we'll see. So I think people are getting impatient. People have many questions. I see people who are using Healy from long time still have questions. Okay. Pragya ji, please, last question. Huh? Yes.
Yeah. So question is, it was actually asked 3-4 days back to me, and I thought of, clarifying it because we will have the sessions only. So one of the person who started using Healy abhi recently, she said कि जब ये detox का program ले रहे हैं, तो जब start करते हैं तो ऐसा as such कोई, there's no vibration feeling in the hands, पर अचानक से in between, it's like, something is happening and you can really feel that something is getting transmitted in your body. And after, let's say 5-10 minutes, even the program is not yet over, the sensation will go away and again it will come back. So what is it? What is the meaning of it and all of that? The
sensation is only because of the current. So reduce the current and use the device. No problem.
So even if you've set the frequency where it started flowing and if you can feel the vibration, then you reduce it, then?
How much is the frequency? कब sensation feel होता है?
So when जब उसने बोला कि मैंने start किया था, तो my frequency started flowing at 40-45 ऐसा कुछ, ठीक है? And then it was set at 40-45 and she started doing her work. And while she was doing her work, अचानक से she started feeling vibration in her hand. It was there for some time. ऐसा भी नहीं है कि end तक था. वो चला जाता है frequency.
Was she able to bear it?
हाँ, she said it was okay, but then वो feeling शुरू में नहीं था, बीच में आ रहा है, फिर जा रहा है, फिर आ रहा है ऐसा.
Body respond कर रहा है, no problem.
किया है, ये मुझे भी बहुत बार होता है.
Body respond कर रहा है accordingly, no problem.
So उनको कुछ frequency को बदलने की जरूरत नहीं है ना?
अगर बर्दाश्त कर पा रहे हैं तो जरूरत नहीं है.
All right.
Okay, no problem. Yeah.
Thank you.
Most welcome, Pragya ji. Yes, Pramod ji, you can unmute and ask your question.
Yeah, just one thing. Sometimes for a set percentage, suppose you are setting it 45%, sometimes you see for a certain frequency, the flow is not there. After that frequency, the flow resumes. So for that particular frequency, it's not worth increasing the percentage, no? Then again, for the next one, you'll have to reduce it again.
That will happen when you are monitoring it as a share market. I told this is not share market. The device is intelligent. I think I have answered this question in the previous training also. If the device decides that you don't need the frequency, it will stop. The flow will stop. Let's not put our head into it. Let's not worry whether it is flowing, not flowing. The device has decided that it should not go in your body. It's not going. Let it do.
So is it because the device has decided, or is it a block?
It's nothing is a block. The device decides that you don't need it. After every 10 seconds, it is analyzing. The device decided that you don't need that. It's not going. Or device decided, no, you need to give a break for 10 seconds before you give the second frequency. It is just doing that. Okay. It's a very intelligent device. So, we don't have to worry about whether it is flowing, not flowing. As I said, start the device, do your work, because you're not bought Healy to take out special time for healing yourself. While you're working, while you're doing your work, you use Healy, let the Healy happen, let the work happen. In the app, you do your work, let Healy do it.
No, this I have noted for my wife who has a specific issue. So I'm running it for her issue. So I'm seeing, so that's why I'm wondering whether it's a block happening at particular frequencies.
There is no block happening. It is whatever is happening, it is as per Healy. Healy's intelligence. So let it happen. Just keep using it, no problem. Perfectly. Okay. Fine. Yeah, Javin sir, please ask one question, sir. Yes. पूछिए सर, अनम्यूट कीजिए सर, अनम्यूट कीजिए जयविंद सर, अनम्यूट कीजिए.
Thank you for giving me chance again. एक ये सिर्फ दो बातें हैं। यहाँ से अदर कंट्री में अगर मुझे रात को प्रोग्राम देना है ब्लू से, तो उसमें मैं ब्लूटूथ ऑफ कर सकता हूँ? ब्लू ऐप
ब्लूटूथ
से
ऑफ करके ब्लू ऐप में ब्लूटूथ ऑन रहना चाहिए।
ओके, ब्लू ऐप में ब्लूटूथ ऑन रहना चाहिए।
हाँ, पिंक ऐप में ब्लूटूथ ऑफ कर सकते हैं, ब्लू ऐप में ब्लूटूथ शुड बी ऑन व्हाइल यू आर रनिंग द।
वेरी गुड। मेरा एक डाउट आपने क्लियर किया। एक और है,
या
नाइट में क्या हमें ये जो हीली डिवाइस है उसको चार्जिंग पे लगा के रखना है या चार्जिंग ऑफ कर सकते हैं?
नहीं, कोई भी डिवाइस चाहे लैपटॉप हो, फोन हो, कोई भी डिवाइस को रात में चार्ज में लगा के नहीं छोड़ना चाहिए, बिकॉज इट इज ओवर चार्जिंग एनी डिवाइस रिड्यूसेस द लाइफ ऑफ द डिवाइस, सो डोंट ओवर चार्ज योर डिवाइस। यस,
तो हम रात को उसका पूरा ऑफ करके, तो मान लो 4 घंटे का प्रोग्राम है, 3 घंटे में ऑफ हो गया
तो होने दीजिए, अभी आपको पहले से चार्ज कर लेना चाहिए था। ठीक
ये
है,
2 क्वेश्चन थे खास।
ठीक है, नो प्रॉब्लम सर, वेलकम, मोस्ट वेलकम। या आई थिंक finally the question answer round is over, and let's see who became the crorepati.
Chats questions are there, shall we take?
Yeah, okay, still questions are there. Okay, sorry to say we will continue this training again because there were so many questions, and I'm so glad that people had questions. So we'll continue this training again from how to use the blue app in first 7 days and how to use the blue app in particular. But first 7 days, this is what you have to do. So we'll continue the training again maybe after 2 days, because 6th we have an event. Please be a part of the event. Don't miss the event. If you are in Bangalore, must come. Dinner arranged. Amazing. It will be an amazing event. Technical presentation also for our prospects. So invite your prospects, invite your friends, invite your family. Be a part of this event and witness what has changed in the last 1 year in Healy. Yes, Rajendra, what are the questions in the chat?
Yeah, there's a Keso asked the first question. Sometimes even at 100% frequency, there's no current flowing even after in spite of being hydrated.
No problem. It's okay. Let it not flow. Okay. So it's okay. It's not flowing, no problem. If your wires are connected, if your this thing is connected, your everything is set, don't worry about what is flowing, what is not flowing. Yeah.
So what's the difference between blue and pink app is already answered.
Yeah.
Somebody, Indrani asked, Indrani, pure she understood. Now can you explain about care?
No, there's nothing to explain about care. Run the care program in the second day. Okay. Yeah.
Okay. The next question is.
Means you want to understand what programs are doing. So go to Healy Academy, download the Gold Cycle brochure, the manual. You can read what does the program do. Yeah.
If the person far, can I run Gold Cycle program in the blue app? I think it has been answered. Yes.
Yes, I have already answered that question. Okay, what is the logic behind? I'm reading the question. What is the logic behind the gap of 15 minutes with the coil and 1 hour? It's very simple. With the coil, you are using magnetic field, interacting with your information field. With the coil, you are directly giving it to your cell. Your cell needs time to digest the frequency and the current which you just took. So you have to take a gap. If you don't take a gap, you might feel mild headache. So that's why we say take a gap, let the body adjust it first, then start the second program. Yeah.
The next question is from Simani. While using pink app, using coil, do we need to be near coil or we can stay anywhere?
I have already answered that question. Coil, the wire, the device has to be in your pocket.
Arpita is asking, once we have run the 7 days gold program, will we use pink app again?
Absolutely, pink app has to be used. Pink app has to be used, Akshita ji. Without pink app, how will you use Healy? You are paid for the pink app only. Blue app is like okay, but pink app is the main one. Yeah. Any other question?
Yeah, I think that was.
Usha ji has a question. Usha ji's question. Can you read it? I'm not able to see Usha ji's question. I think that question is already answered.
I'm taking all one by one, so it will come, I think.
Usha ji's question was already answered by somebody else has asked the same question. So, okay.
Started using Healy since 3 days using coil for gold cycle. but running with 30%. Do I need to restart with pure again with 100%?
Yes, you need to. Coil 100% always, remember that. Yeah.
Okay.
Can a smartwatch and Healy be worn together? Absolutely yes.
I think this
Absolutely yes. If you're wearing a smartwatch, you can wear a smart Healy also. No problem.
From Manjuji. Hi, it's important to drink water. My friend daughter is reluctant to drink water. She's having only juices and bottled drinks. She's having autism and seizures. 12 years old. Is it okay to run pink app or we have to run only blue app? Please advise.
Run the blue app and run the pink app with the coil. I just wanted to understand out of curiosity, if she doesn't drink water, what is juices? What juices are you giving her? If you're going the cold drink or any soft drink, you're killing the child. I have a lot of videos. I have done a lot of research on how cold drinks are very, very dangerous for your health. If you're giving those drinks to your children, you're giving poison. It's better buy a rat poison and give it to them rather than giving cold drink. Cold drink should be a strict no in your home. If you're bringing cold drink in your home, you are bringing poison in your home. So no soft drinks to be given neither to an adult nor neither to a child.
I think she's having seizures and 12-year-old, so I think it should be.
So if you want her seizures to be improved, give water instead of cold drinks. I don't know what juices is he drinking. I want to know that.
And seizures is there means she should use coil, correct?
Yeah, seizures, use the coil. Please drink water. If she's not is reluctant, give water. She has to drink water.
Dr. B.K. Mahapatra is asking, can we use the device connecting the charger?
No, you cannot use the device while connecting the charger. You can use the blue app while it is connected on the charge, but not the pink app. Okay. Okay. Thank you so much, everybody. It was a wonderful day. We had a lot of questions. People had a lot of questions. We'll continue this training on 7th. On 7th, we'll have a same training. Tomorrow, we are going to have a business training. Those of you who are building this business, I request you to join tomorrow.
Well, one or two questions more.
Okay.
Yeah. Nitya asking, can I use two devices together with two different programs?
With the wire, no. With the blue app, yes.
Sandeep asked, which program to run for diabetic and BP patients?
That will do it. First, you run the gold cycle. After gold cycle, what has to be done? Whether it is diabetes, BP, anything, we follow the same process for everybody, irrespective of the disease. Stay connected. Again, let's get connected on 7th. I will cover that part on 7th.
Mr. Rajuji is telling that I'm Raju here. We met at Bangalore at Siva Yogi sir class. It is very nice. I'm using Healy. I'm watching. Thank you.
Fantastic. Thank you so much, Rajuji. Lovely listening to your feedback. People like you who are using Healy and giving their feedback. It's absolutely amazing.
Kushalji, question is, since the battery is showing low battery occasionally, I'm not able to finish the program. Should I start the program again?
Yes, you just start the program again, and I just got. Okay, what we do is tomorrow we come to continue the training at 6 o'clock. And then 9 o'clock we'll have business training. 6 o'clock we'll have product training, which will finish at 7:30 sharp because 7:30 we have presentation. So 6 to 7:30 we'll continue this program. I know you have a lot of questions, and I was literally mesmerized by the questions you have asked. It means you are using the device. If you are using the device, we'll rock more. So if you are using the device, it's absolutely amazing. Okay, thank you so much. Let's end the session. And 6th, where be ready on 6th of October in Bangalore. There are people who are coming from Kerala, from Hyderabad, from Chennai, from all the southern state, from Maharashtra, from so many places, even from Northeast. So people are coming to Bangalore for this event. If you are there near in and around Bangalore, and if you are especially inside Bangalore, you must be there on 6th. It's an event. It's a Mahotsav. Be a part of the Mahotsav and enjoy. Thank you so much, everybody. Have a great night. Bye-bye.